Hi, I'm Dr. Felice from the Movement Therapy Institute, and today we're going to be going over how to assess your neck and just kind of do a check-in to look at the mobility and to see if you're having any discomfort. So the first thing you want to do is bring your chin to your chest. And I'm going to turn to the side so you can see. So you want to make sure that your head's not here, and then just bring the chin down to the chest. Can you touch your chin to your chest? Do that a few times. And then you're going to look up, bringing the head back, and then back to the center. Making sure that you're not lifting your shoulders and that you don't feel any pain or pinching. Next, we're gonna look at rotation. So you wanna make sure that you don't move your torso or your shoulders. Arms are by your side. You wanna turn your head and then try to touch your chin to your collarbone. And then come back to the center and then switch to the other side. Turn your head and try to touch your chin to your collarbone. If you're able to do that, you're in a good place. If you're doing it and you notice it's a little sticky or your neck doesn't want to move, then we want to check that range of motion. Now we're going to be going over some exercises that you can start. If you're having discomfort or just a tightness in the neck, these are some baseline exercises that very easy, very straightforward, and you can get results pretty quickly. You can use a pillow. I like to use a Gorgeous ball from our friends at Yoga Tune-Up. So this is going to go in between your knees. Arms are going to be by your side. So in this position, you're going to go ahead and start by tucking your chin in, and you're going to go ahead and lift your head slowly as you're bracing your core. Think about bringing the rib cage to the pelvis and then squeezing your ball and then coming back down. And then back to neutral. Tuck the chin in and then lift your head up as you brace and squeeze, exhaling on the way up. And then I'll do one more. Tuck your chin, lift your head, squeeze, brace, breathing out like you're breathing out through a straw. You can keep your hands here if you want or off to the side, and then coming down slowly. This next exercise is going to be on your stomach. You're going to prop yourself up on your elbows, and it's called prone on elbows. We're going to look down and up, and then we're going to create rotation. Lying on your stomach, place your elbows right underneath your shoulders. Make sure that the shoulders are away from the ears. Drop the head down, and then look up. So you are going against gravity here, and ideally, it should be a smooth movement with no pain and no discomfort. If you have pain, let's say at the end of the movement here, then you want to go shy of that. So maybe for you, you just go from here and you stop right there. But if you have the available range of motion, look down and then look up all the way. Next, we're gonna move into cervical rotation. So sometimes, when you wake up in the morning, you just have a stiff neck and you can't move. This is a great exercise for that. You're gonna go ahead and start with your head in an extended position, so looking straight ahead. And then you wanna turn and try to bring your chin to your shoulder. Now you can rotate the trunk, you just wanna make sure that you're not lifting that hip up. So you wanna avoid too much rotation, but rotate at the neck and your trunk. So now when you're here, you wanna make sure that you're also protracting, meaning you wanna push the shoulders away from you. And then as you turn, pull that elbow back a little bit so you can get a little activation in that lat. Okay, so it looks like this. I'm gonna rotate, I'm gonna pull it back and try to touch my chin to my shoulder. So again, protract the shoulder, pull, and you should feel it right underneath that shoulder blade. And you'll do the same thing to the other side. The next exercise that we're gonna be doing is called a chin tuck. So you wanna make sure that you're upright and you're not slouching when you're doing it. And then you wanna bring the chin towards your throat, tucking the chin in. It's almost like you're giving yourself a double chin. And just hold here. Hold for 2 seconds, and then come out of that position. And you're good to go. This next exercise is called cat-cow. So really what you want to do here is segmentally move your spine, meaning one vertebra at a time. So you're going to place your hands underneath your shoulders, knees underneath your hips, and you're going to go ahead and look straight ahead and then work your eyes up, arching your back, and then pushing your hands into the ground, tucking the tailbone. Sometimes you can feel tightness in other parts of the spine, even though our neck is what's hurting, because the neck is part of the spine and they're all connected. And then of course, if you are having discomfort, go through the motion, but maybe don't go up all the way. So maybe you would stop right here. And then if it hurts to do this, then you wouldn't go up all the way. You kind of would stay more in the middle range.